Well, I'm showing 12:02, so we'll go ahead and get started here. My name is Allie Orwig, and I'm with the Indiana Rural Health Association. We really appreciate everyone who's joined us today. So happy to have you with us. We've got a great presentation from Jessica Devine. Really excited to get this out here and want to do a couple housekeeping items right at the top of the hour. If you do have any questions, you are free to ask those via the Q&A or chat function. You can do that anytime during the presentation, and I will act as moderator. You can find those functions by hovering your mouse either at the top or bottom of the screen, depending on which view mode you're in, and a little bar should pop up or down. You should be able to see that and submit questions that way. We can also use the raise hand function at the end of the presentation if you would like your line to be unmuted, if you would like to verbally ask your question of Jessica. We are recording today's session, and it will be available by the end of the week on our YouTube channel. So if you have to step out and miss part of it, or if you really, really love it and want to share it with others, it will be available for everybody publicly there. So I think without further ado, I will go ahead and turn it over to you, Jessica.
Thank you, Allie. And thank you everyone for joining today. I'm so glad you've spent some time with us this afternoon. So this presentation will be about reducing suicide in rural Indiana and beyond. My name is Jessica Devine, and I'm with IRHA. So to start, the usual funding disclosure for the grant that I'll refer to a few times through this presentation. After today, I hope that you'll be able to find data pertaining to suicide from your county of work or residence as of interest to you, that you'll be able to describe at least 2 methods for amplifying local resources for suicide prevention, and that you'll be able to describe at least 1 area of research within suicide prevention at a very high level, just to be aware of some of the options that are in the future for providing more hope. As a little bit more background about me, I am a graduate of Purdue University. I have a Bachelor of Science from Public Health. I work with IRHA on the RISE Squared grant, which I'll refer to more through this presentation, as well as the UMTRC and Connecting Kids to Coverage. Your life is incredibly important, and I'm really glad you're here. That's always a sentiment that I have, but especially with today's presentation, wanted to be sure to start with that. To begin today, I'd like to invite you to think differently about suicide. Historically, suicide was often seen as a moral failure, but research has unraveled a lot about how different mechanisms within the brain, just as other things affect the body, can affect the brain as well. And so with this discovery, or rather I should say with so many discoveries with genetics and biology and chemistry for what exactly goes on that we can't see when someone is suffering in this way, there's been more recognition of how we can respond to this. And in anticipation of this, in July of 2022, a 3-digit number for mental health emergencies will go into effect. So dialing 988 at that point will route directly to the National Suicide Prevention Lifeline. This is meant to be very similar to 911 in addition to 911. So it's not replacing 911, it's simply another tool that we'll have for responding to mental health emergencies. So that's very exciting to look forward to next year. In the meantime, there's a number already established for this National Suicide Prevention Lifeline that I've included on the screen. If you'd like to, please feel free to save it into your phone contacts to have access. I'll have it up on the screen again later in the presentation as well. As background for the Rural Indiana Suicide Evaluation Education Network, referred to more shortly as RISE Squared or RISE 2, depending on formatting. This is a grant that we've had with IRHA through this past year that began as a collaborative network with 4 hospitals in Indiana in Gibson, Grant, Greene, and Rush counties, focusing on preventing suicide. And a statistic that really stood out to us as some of the background for this project and this endeavor with the network in 2016 through 2017, as you can see, I've included on this slide, 2,106 Hoosiers died from suicide, and that's a lot of lives that we're grieving. As we were going through data, there are several options available to be able to find more. So We always go through life with our personal experiences and anecdotes, and that's really important for shaping who we are and how we think. But being able to pull data is really great too, to get a bigger picture and to know what's going on beyond just our own experiences. And so for data with suicide, the CDC is always a great resource. The Youth Risk Behavior Surveillance System also has measures from throughout the country. The Indiana Department of Health, always a great resource. And the Indiana Youth Institute also offers some data that is very useful that we used with our suicide prevention efforts that might be of interest. Considerations with suicide data to keep in mind: suicide deaths might be classified as other causes of death. And when we say suicide, oftentimes we presume that we might be referring to death from suicide, but in research with suicide and as we go about trying to think how we can be most helpful in preventing suicide, we might also want to include non-fatal injury, thoughts of suicide, plans of suicide. So those are good to keep in mind. Self-reported thoughts of suicide could be impacted by self-consciousness or withheld if the participants are concerned about remaining anonymous, because this is such a topic that many people are really reluctant to talk about. So in addressing that, we can improve sometimes people's confidence or willingness to self-disclose and to share their stories by using secure data collection and storage platforms. So if you are working in this manner, you might consider some of these data collection and storage platforms. And if you are not someone who formally works with suicide prevention, that can just be something to keep in mind with supporting the efforts of others, that we always want to support people and work with the ways that people most want to be able to contribute to this effort. In our efforts with RISE Squared, we conducted key informant interviews with stakeholders in our particular communities. And if you are also involved in this type of work, I of course invite you to do the same in your communities of interest. And this is very particular to the stakeholders and individuals that you'll interact with. So I've included our particular questions really mainly as examples of wording. Oftentimes when talking about suicide, we might feel nervous or intimidated when we first begin because it is a topic that so many people are reluctant to share about. And so if this wording is helpful to you, it's here as just how we did this for our particular efforts. We were particularly interested in barriers and challenges that people faced with suicide prevention. And so we worded these questions seeking to get really open-ended responses and simply start conversations for individuals to share whatever info they felt was pertinent or most helpful to share. And with that, just a few of our results. And again, to emphasize that these were just from particular individuals that we interacted with and might not be at all like what you would hear from interacting with the individuals that you'd be working with. But in the effort of sharing in case it might be of note, we heard that parents might feel hesitant to ask their child if they noticed something that was of any concern. They were reluctant in concern that their child might be mad at them for intervening. Talk therapy can help people cope. Sometimes people had ideas about medication, and it's important to emphasize that there are several options available, and kind of focusing in on that talk therapy sometimes as a separate entity can help with stigma reduction and in simply helping introduce people to the conversation and of interacting with the options available. Trust with a therapist is necessary. So for our particular work in rural communities, this was of concern because there might not always be multiple therapists available. Telehealth can be an option to help address this. And finally, some people mentioned that they didn't want to call a national crisis number line, that they'd prefer to call a local number. And I mentioned this to encourage, especially on this topic of interacting with your communities of interest and where you're living and working, because conversely, other people expressed that they liked the idea of interacting with someone who didn't know them, that didn't live in their community. Some people mentioned that they would be reluctant for a neighbor to see their car parked in a certain place. So I've included these as some ideas that we've heard, but I invite you to conduct these in your own areas in a similar way. So with this information, we can then move forward with talking about how can we help reduce and prevent suicide or intervene in crises. And so to speak in a way that hopefully is helpful for everyone listening to this presentation, I'll discuss a variety of ways that we can engage with this. So first and foremost, it's critical to reduce stigma. As I have mentioned, and as I'm sure you've probably encountered in your own lives, stigma can often be very involved with our efforts for suicide prevention. And so as we go about, we can consider if our words are supporting life as a very broad level place to start from with that. Additionally, we never want to reinvent the wheel. So we can consider who's already involved with suicide prevention as we start thinking about how we want to get involved and how we can be most useful to adding to this and contributing. So I've included here on the slide some examples of individuals who are certainly already involved in these efforts in your communities: emergency medical services, law enforcement, healthcare providers, educators, faith leaders. These are people who are already aware and are concerned and would probably be interested in speaking more to find out how we can better collaborate and better optimize our shared resources, efforts, and ideas. So in summary, a good place to start is to begin talking with anyone who has a stake in this, which really is everyone. But some people have already interacted more. Additionally, social media efforts can often be quite impactful. Hiding the pain of suicide can be immense, but we know that sharing our stories and that level of social support with our peers and our loved ones can bring a lot of benefits. And so social media allows that opportunity sometimes to realize it's not just me who's experiencing caring for someone who's going through this or someone who is thinking of suicide. Social media efforts can help advertise our efforts with suicide prevention, as well as support stigma reduction. Additionally, we can encourage individuals to consider counseling. So a thought with that is that we already go to several healthcare providers for primary care for other aspects of our physical health, and we can consider going to therapists for primary care for our mental health as well. There are all kinds of great infographics available online that can expand on this even more. Some that I've seen have pointed out how going to therapy can be helpful for considering big life choices, for talking through things with a third party who's not involved, and all kinds of other endeavors that help support a high quality of life. So in that way, therapy can be very helpful, certainly for individuals who are healing from trauma, but therapy can be helpful for a variety of life experiences, and hopefully we can intervene much earlier before it reaches a state of trauma. So this slide, as I mentioned, has some numbers that I invite you to pull out your phone right now if you have it and save these numbers into your contacts so that you have it for easy access. It's great to increase awareness in the community of crisis lines. So if you have it available yourself, you can access it if ever needed. You can mention it to others that you know. One effort that we encountered in our work was that sometimes individuals such as business leaders or faith leaders in the community really wanted to do even more than they already were for suicide prevention, and they weren't always sure of opportunities to do so. One individual suggested that owners of small businesses could keep little cards available or in some other way advertise these numbers to help increase awareness of the opportunity to call for help and support. So the National Suicide Prevention Lifeline number is available for anyone who's in crisis as an individual, and it's also available to support others who are concerned about someone in crisis. So they are available 24 hours a day. It's free, it's anonymous, anyone can call, and their goal is simply to help best support people. There are options to better reach more people, and so they have a number available for individuals who are deaf or experience hard of hearing. There's a number available to speak in Spanish. There's also an option to text a crisis text line, and some people feel more comfortable with that. So they've really tried to make this accessible, and I have no affiliation with them, but from their website, it seems like they are really trying to focus on how they can reach more and more people. So I encourage you to, if you haven't already ever looked at their website, they offer some educational resources and some more information about these numbers. And I hope that they'll continue to expand the resources they offer. Additionally, if you are involved with workplace efforts for suicide prevention, some of our partners implemented quality improvement projects for all of their clinical departments to screen individuals for suicide ideation. So this can often have large impacts for suicide prevention. So these partners have implemented where if a patient comes into the orthopedic or their primary care department, they'll get screened for suicide ideation. And we were really encouraged with this, that it's not just the emergency departments who are screening for this, because prevention is often much more supportive of a high quality of life than having to intervene in a crisis. So if we can identify this for patients before they reach that point of crisis, that indicates that we'll have probably a more positive experience for everyone involved. So that was great to see our partners implementing this. We can also consider gatekeeper training for entire organizations. So gatekeeper training is a very broad term used to refer to trying to empower individuals with the knowledge and skills and the confidence in their knowledge and experience to be able to interact with people, to ask about if someone is thinking of suicide, and to then know how best to respond to that. So there are several options with this. Some that might have heard of include QPR training, which is question, persuade, and refer. There's mental health first aid. There's several other options that's by no means meant to be an exhaustive list and not to endorse any more than any of the others. But the efforts of gatekeeper training are not just for clinicians who are directly interacting with patients who might be involved in diagnosing, but it's really beneficial for anyone, because anyone who's trained can take those skills home. So if we train entire organizations, what we've done is not just train people who work in a certain place who are going to interact with people in that workplace, but at the end of the day, we all go home to our families and our friends, and we take those skills with us. So when we train entire organizations, we're really training community members who are going to be living among us, with us. Hopefully we are people who are trained, who have these knowledges and skills, who have the ability to really be helpful in working with suicide prevention. Another endeavor that's near to my heart is encouraging young people to consider careers as providers and researchers with mental health. Historically, there has not been very much of a focus or priority on mental health, and there's hope that there will be increased funding with this. So this is all just very speculation, but in light of the pandemic that we are all living through, some states such as North Carolina and Colorado are two that I'm aware of have declared, seeking to declare states of emergency specifically with pediatric mental health, as children have not been able to access school-based resources in the last year, such as counseling or other variety of other resources that can often be helpful with mental health that they haven't been able to access. And that's simply looking at one particular group of people. For adults, we've experienced a variety of different stressors, and a variety of different patient demographics are starting to see the effects of this. So in recognition of this, there's been increased focus, at least, on trying to provide more providers We're probably all aware that Indiana experiences a shortage of mental health care providers. This has been existing, and the pandemic has perhaps exacerbated that. So telehealth is one opportunity to seek to expand the availability of care with that. But in efforts of all of this, when we look to encourage people as they're considering where to focus their efforts, there are funding opportunities to reduce financial barriers for anyone who might be interested. So there are opportunities for clinical training, and then of course with research training. There are many fellowships available with that. To dive a little bit deeper into that for all of us, to speak about some areas with research with suicide prevention, I like to summarize it as if anyone has an interest in suicide prevention, they can use their own individual skill sets in a way that's going to be really helpful for that. So as just a very small sample, this is by no means all-inclusive. It's not meant to elevate any particular focus above any other, but simply some that I'm aware of that I think are going to be great to watch, to be aware of. If you have an opportunity to contribute, by all means. There is work being done by computer scientists and other people with technology to develop applications for phones, for vulnerable groups to prevent or intervene in a crisis. So the goal of this work certainly is to increase the opportunities to reach people. There's work being done with MRI, with the brain to physically identify patients who are thinking of suicide. So this would be really big because currently our work with suicide prevention relies on people self-identifying and offering the information to speak out when they are in need of help, when they're hurting. And so having an option to be able to physically look and see if someone needs help, if they're not able to vocalize this, perhaps they don't recognize in themselves, perhaps they're unaware, perhaps they feel that they're unable to access resources. There can be so many reasons why, and having that opportunity would be helpful for some of our prevention efforts. There's work being done with genetics to increase personalized medication selection. This is work being done across all fields of medicine, and it's perhaps especially of note with mental health work because some people have concerns. There have been some problems with people having very deep set reservations about medication. And so the more work that we can do to improve this process and to improve the outcomes for patients who are pursuing this option, the better off we are. There's work being done with language translation technology to remove some barriers that have perhaps prevented some patients from seeking help or support. There's work being done to identify trends after disasters, to optimize allocation of resources so that limited resources and capacity can most efficiently be distributed in ways that will be most effective. So in summary, there are all kinds of different efforts in progress right now, and I hope that that helps boost your hope that there's a lot we can do currently for suicide prevention, that suicide, if someone has thought of suicide, this can be survived. And in future, we anticipate that there will be more and more opportunities with diagnostics and therapeutics to better support our efforts. And so with that, there are several opportunities that someone could contribute to this work through their work and their career. And there are also just opportunities for us to be aware of the increasing options if our loved ones are ever in need. Speaking of suicide prevention with our loved ones, on this slide, I want to speak more directly about that of how we can better care for our loved ones. So I'd invite you to discuss with your loved ones about coping with suffering in life. And there's not necessarily a right or wrong way to do this, but just having that infrastructure of knowing how to process when things don't go well, when things don't work out how we'd hoped, no matter how bad it can seem, it can be survivable. Modeling and encouraging healthy habits for a high quality of life. Of course, as a public health scientist, we always like to offer this for every area to optimize our enjoyment of life and our ability to experience all the good things. And finally, This is one of the last bullets, but perhaps of the greatest importance. If you're concerned about recent behavior or words, I always want to invite you to ask the person directly. Some people can have reservations about asking about suicide, and this is very understandable because it can seem like a very scary topic. There might be a lot of nervousness or aversion to speaking about it. But evidence has suggested that simply asking someone very directly, have you thought about suicide, can decrease the likelihood of harm. And there's a lot that we don't know about exactly how this works, but there's indication that having these really strong social ties with loved ones and feeling valued and feeling connected can be a protective factor against suicide. And so in that endeavor, it's unsurprising that asking about someone and showing that we really care, that we're really invested in keeping them with us, and that we are interested in their well-being can really help support their healing and help individuals to live healthy lives. So takeaways in summary, we want everyone to enjoy a high quality of life. Suicide can be something that people survive if they've thought about, and there are a lot of ways that we can support them in this. Data elucidates what is happening beyond our personal anecdotes and experiences. So while those are very important and can really shape why we're involved or how we're involved, it's great to seek out some of these sources available to us to understand better about what's happening on a larger scale. Asking directly about suicide can have several positive benefits for a community. So this certainly applies in our personal relationships and interactions with others on an individual level. But if you have the opportunity to be involved with any surveying or other research with suicide prevention, it's something to keep in mind that asking in the survey could be beneficial as well. If you are working with that, we'd certainly be happy to speak more directly about that. But this presentation was focused on our broad audience. And finally, there are many ways you can contribute to preventing suicide. The methods that I've described in this presentation and the efforts and ideas are by no means an all-inclusive list. There might be ways that you're already involved that I didn't mention or that I might not even be aware of, because ultimately with suicide prevention, because it can be such a seemingly individual experience of we can't necessarily see how someone is experiencing this. And in that way, it makes everyone's input all the more valuable, that everyone's skill sets and their personal experiences are really helpful in these efforts to better reach everyone and support everyone in seeking their high quality of life. So I've tried to leave a lot of time for questions. If anyone has any questions about anything I've mentioned or other areas with suicide prevention, please feel free.
So I haven't had any questions come in the chat function yet. I do want to share with everybody real quick our survey link that we use to evaluate today's session, and it's the data from those allows us to continue having these free lunch and learn programs. So literally takes 60 seconds or less to fill out. I truly hope everybody will follow that link there in the chat and give us your feedback. If you would like to submit a question at this time, please do so using, again, the chat or Q&A function. Or if you would like to ask your question verbally, please use the raise hand function, also at the top or bottom of the screen, depending on your view mode, and we'll unmute your line so you can ask Jessica verbally. And while we wait here for just a second, of course, want to thank Jessica Devine very, very much for this great presentation, very informative. Hopefully gives you a great model to take back to your own communities and implement a program yourself. I think some of the key takeaways for me when I worked on this program with Jessica was just getting the right people at the table with the passion for this makes the workload much more manageable. We had great partners in the Rise 2 network, and we're going to continue that work with them and look to expand. But that would be my number one piece of information for you. Make sure you've got all the right partners and that everybody's committed.
Absolutely. The partner engagement was fantastic and unsurprising because everyone was invested in this effort, and it really showed in the output of the work that we were able to do.
Well, I'm still not seeing any questions come in, Jess, so you must have really covered it so thoroughly. Everybody's got everything they need, and we'll just be able to go ahead and close the session a little early and give everybody some time back today. But again, thank you to all of our attendees. Thank you to Jessica for your excellent presentation. We hope you all have an excellent day.
Yes, thank you so much for joining, and echo that about hope the rest of your day goes well.